Welcome to one more show. So, today we'll discuss the study that is conducted by the Taiwanese researchers with Stanford US researchers. The data is from the US population, and millions of patients were included in it. Not patients really, they were the vaccinated versus unvaccinated individuals. And what the researchers found was that in the vaccinated group, messenger RNA based vaccines, in the vaccinated group, at about 2 years or more, the hazard ratio of the retinal vascular occlusion, that means blood vessel occlusion in the retina or partial or complete blindness, was more than twice. The hazard ratio was 2.19 in vaccinated compared to unvaccinated. This is the study. Of course, the question would be in your mind that does it happen with the adenovirus based vaccines? They do not have an answer for that. Then you might be thinking that this is age related or comorbidities related. They did a very good matched analysis because they just had a very large number of people to compare. Then you might also be thinking that is this something to do with the drugs or other such lifestyle choices that people may have been making, and they had excluded patients both from the control and the vaccination who may have been taking drugs that had the potential for causing vascular occlusions. So very clean one-to-one match. And in the vaccinated, messenger RNA vaccinated, the hazard ratio of the vascular occlusion was 2.19. Let's look at this study. It was twice as much in 2 years. Very concerning, of course. So starting off from here, this is drbean.com. In the description of this video, there is a link that gives you access to all lectures, about more than 800 lectures in drbean.com, in addition to what we have here on YouTube, only for this very tiny amount. And we are kind of lagging behind. We are trying to go to the courses based fees where the same videos are packaged up into smaller number of courses, for example 33 hours or 8 hours, and we are going to sell them according to the course. We have just not reached packaging up all of them yet, and this was supposed to be out in January. Anyways, if you would like to have access to these videos, we continue to offer the videos that were already there, plus all the new videos become part of this package as well on drbean.com. So take advantage of that. This is the study, Risk Assessment of Retinal Vascular Occlusion After COVID-19 Vaccination. This study is published on 2nd May 2023, so hot off the press. Then there are some more links here in the description about what is hazard ratio, then what is the antibody mediated platelet activation, because we'll talk about that, then what is the central vein occlusion, and what is the platelet factor 4, because we'll talk about that as well, and then what is the hazards of the retinal vascular occlusion. So with these in mind, let's start with my drawings. So these are the gifts for humanity, and they're continuing. Unfortunately, once again, today's talk is not a very happy talk, but let's see what we are learning. So BioNTech vaccine, mRNA 1273, or the Pfizer, BioNTech and Moderna vaccines. The cohorts are unvaccinated and vaccinated individuals. And this is what they found. They found the hazard ratio of the retinal vascular occlusion, which includes 4 types, and I'll discuss them in a second. That hazard ratio is 2.19 compared to unvaccinated individuals. The 95% confidence interval is 2 to 2.39. So twice as many incidence, twice as much incidence of the retinal vascular occlusion to 2.39 times. So that's a very high number, and it is statistically significant number. That also means it's not a fluke. It is something that is really concerning. So in their paper, in their manuscript, they write, risk of retinal vascular occlusion significantly increases following vaccination in individuals without previous retinal vascular occlusion. So you might be thinking that, hey, these patients may already have this problem and it's just got tagged into the post-vaccine issues. So researchers made sure that they only looked at those patients who did not have previous retinal vascular diseases, or they were not taking any drugs that may have a potential for causing vascular occlusion. Or even if they were taking heparin or other, that means their body had a tendency for coagulation and now they're taking some medicines to counter that. So researchers had excluded such patients. So they further say in their manuscript, the risk of retinal vascular occlusion significantly increased during the first 2 weeks after vaccination. First 2 weeks were almost 3 times as much and persisted for 12 weeks. Additionally, individuals with first and second dose of BioNTech and mRNA 1273 had significantly increased risk of retinal vascular occlusion 2 years following vaccination, while no disparity was detected between brand and dose of vaccine. So it is not that the Pfizer was more than Moderna or Moderna was more than Pfizer. They both had similar but increased hazard ratios compared to unvaccinated individuals' incidence of vascular occlusion. So just a quick note. This is our eye. This is a cross section of the eye. This yellow layer over here is the retina. Now this is the optic nerve over here at this place. Within the optic nerve is central artery and vein. They bring in the blood through the artery and then the vein would take the blood out. So as this red one, the artery brings the blood in, that blood actually goes to retina, then the venous blood then drains back through the branch veins and finally central vein and gets out. Now in terms of the retinal vascular occlusion, the venous vascular occlusion, that is a veins occlusion, is more dangerous because the blood is coming in but is not exiting, and that can cause a disastrous amount of damage within the retina, causing permanent loss of vision. And this is the most common type of blindness from the vascular occlusions. So what does this study say? Here is the design of the study. It is a retrospective cohort study. So it's not a prospective study. They looked at the data. The data was present in TriNetX global network. They took the data from January 1, 2020. Look at the size of the duration, the window. January 1, 2020 to December 31, 2022. So 3 years. And there were 52 healthcare organizations that were placing their data in this data network. They restricted the data analysis to patients' data from the US only. So as much as the team is from Taiwan and Stanford, the data is US patients' data. So here, if you look at the same diagram once more, the question is, what did they include? What diseases did they include? So here, H34, which is retinal vascular occlusion code for the International Disease Code. So that is any blood vessel inside the retina or supplying the retina. I would call it as central artery occlusion, branch artery occlusion, central vein occlusion, branch vein occlusion, all four. And if you see here, they had actually included all four kinds of occlusions. What that means is, let's say we take central artery. So here's the central artery that comes in, should be red in color, but doesn't matter. And here are the branches of it. So where is the occlusion? Is it in the central artery itself, or is it in the branched arteries? So all of those codes were looked at. What was excluded? Patients who had a previous diagnosis of retinal vascular diseases, they were excluded. Patients who were on antithrombotics, they were excluded. That means they had the propensity to develop clotting, and so they may have other reasons than the vaccine. Diuretics, oral contraceptives, anti-hemorrhagics, antithrombotics, anticoagulants, and fibrinolytics. All of those are an indicator that there is something going on with the blood coagulation system of this patient, so the researchers excluded them all. So then what was the design? The design became that they started off with a very large cohort. About 95 million people were from the US that could have become part of this study. Out of them, 7.3 million were those who were not infected and were either vaccinated or unvaccinated. And finally, after matching, they brought them down to vaccinated individuals, 739,066, same number of unvaccinated individuals that would act as a control. Infected individuals, they had been excluded. So let's actually very quickly look at the table for how did they do the matching. So here, if you look at this is the table. So they started off with US Collaborative Network, 95 point some million people, more than 18 years of age, and COVID lab negative, 7.3 million. Out of them, if they became positive, they were excluded, 6.7 million. Then vaccinated, 883, unvaccinated, 5.8 million. Then those out of these, about 6.8 million people, those who developed these issues, they took them, and so in the vaccinated, 882,000 and 718, in unvaccinated, 580. So sorry, I meant excluded them. So those who had prior disease, they excluded them, and so then the vaccinated left were 882,000 and unvaccinated 5.8 million. Then they also excluded anyone who was on antiplatelet, anticoagulant, diuretics, etc. that we just spoke about. And so then 745,841 vaccinated and 3.8 million unvaccinated. Then they matched them one by one for age, sex, race, comorbidities, medications, and previous hospitalizations. So this is a very, very decent matching, because you could actually say that somebody who's diabetic and in the vaccination group, and they are vaccinated because they had comorbidities, so they went and decided to become vaccinated, versus somebody who's healthy and decided not to be vaccinated, they are not a good match. So this population size was so large that they were able to find people on both groups that were equally matched. For example, they may have both been young, let's say 18 years of age, or both sides could match 1 and 1 with a person who is, let's say, 60 years of age, has diabetes, and has, let's say, cardiovascular issues. So they did a 1-to-1 match. So this message that, hey, these cohorts may not be the same, that is why the problem is different, that is not the case. Okay, so going back to the discussion here. So this is how they had the cohort. As I said, the ages now. So final group that was included, that group had average age of 52.5 plus minus 18.5 on the vaccinated side, and look at this, 52.2 plus minus 18.2 on the unvaccinated side. Very comparable. Then let's look at the table 2. This is the meat of this study. So I'm going to go to the table 2. So here, this is table 1, and then here is the table 2. If I open up the table 2, let's look at it. And I would request you that after this discussion, if you look at the table 2 as well, age 18 to 64, vaccinated number of events 506,701. So remember that we are talking about 7,788,000 some patients, right? Unvaccinated 506,701. Now, what was the ratios? Retinal vascular occlusion. So any blood vessel, artery or vein, or the branch artery or branch vein, 415 versus 240, and that was 1.87 hazard ratio. If you look at this central retinal venous occlusion, which is the most common reason for the blindness in vascular occlusions, in there the vaccinated had 2.19 the hazard ratio, 2.19 times as many compared to unvaccinated individuals. And this data is statistically significant. Interestingly, central retinal artery occlusion did not have statistical significance in their difference. Then if you see here age 65, then here once again if you look at CRVO, 390 versus 169, 2.5. 2.5 is the hazard ratio, starting from 2.12 up to 3.05. Again, these are statistical significant data points, except central retinal artery occlusion. That didn't have it. And so as you keep seeing and you keep going down, so for example, let's look at females versus males. Females vaccinated had 2.33 hazard ratio, 2.33 as many times. Males vaccinated had 2.4, so 2.33 versus 2.4. So males have a little more. Then whites 2.31, African Americans 2.05, and then Asians 2.62. So almost everyone above twice as much the risk of the occlusion. So this is a very important chart, and please, I would request you to look into it. So then the question became, why? So this is, I think, clear. Such a large cohort of people, both kind of vaccines, both messenger RNA vaccines, both showing similar results. Company or brand or adjuvants of them did not matter. They both had LNPs at adjuvants. So the question is why? I think you would agree that this is clarified, that it is something to do with vaccine. Although they say in their manuscript that we are not able to tell you a cause. There is no causal association that we can establish. We can only demonstrate to you the observed numbers. So they're not able to provide a cause, and this is why they actually say in their manuscript, and let me actually read that part to you. They say in their manuscript that the vaccines, so if we continue going down here, somewhere here I think I had marked it. Here. However, we recommend that individuals without a history of severe allergic reactions to any component of the vaccine be vaccinated to protect against COVID-19, owing to the lack of definite causation between retinal vascular occlusion and vaccination. So we have to make sure that at least we stay true to the researchers' messaging. We have our own interpretations. We will all form our own message here, and then we will all form some decision making, do some decision making. However, in their manuscript, this is how they put it. Okay, so now let's go back to our discussion. So the question becomes why? And I have actually discussed these pathologies many times before. I actually observed that the researchers kind of stayed very light on the pathogenesis because they just wanted to show the data and its association. So some things that came from their manuscript. Number one, they said that we know that messenger RNAs produce the full-length spike protein, and spike protein may be causing mimicry. That means the sequences on the spike protein of proteins may be similar to the sequences on our body tissues, and that can end up causing mimicry. That means our immune system would, after getting deceived by the spike protein in thinking our own tissue is our enemy, would start attacking that tissue and causing damage. And that could be, for example, endothelial damage, that could be cardiovascular damage, that could be other parts of the damage, that could be autoantibodies that are now just attacking platelets and attacking endothelium and so on. So that is one. So they say molecular mimicry of the S protein, which shares sequences homology with human proteins, may play a central role in retinal vascular occlusion. So of course, remember this is an endotheliitis type problem plus platelet activation. So microthrombi are forming that are causing severe damage to the blood vessels. Then they also think a little more and they say, well, it may be the anti-platelet 4 antibodies. We have done this discussion. I believe that when the ChAdOx1, the Oxford AstraZeneca came out, the same month there were some women who developed clotting, and a German study came out which said this looks like a vaccine-induced thrombocytopenic syndrome. They called it something else, but they said it looks like HIT issue. And what they did was they said how this is happening is that, let's say these are the platelets. What happens is that on the surface of the platelet we have platelet factor 4 plus we have platelet gamma 2 receptors on them, where these antibodies that developed against the platelet factor 4, they can start binding either directly to the factor 4 or on the platelet receptor gamma R2 receptors, which eventually cause the platelets to be activated. Now in our body normally there is heparin like molecules or heparin that keeps the platelet from not coagulating with each other or clotting with each other, and it keeps them separate. If for some reason we can disable heparin or reduce the effect of heparin, then the platelets would start becoming clotted, gelled with each other, and they'll start making the microclots. So here what happens is, it is possible that with the vaccines, and this is the example I gave, that the vaccine induces antibody production that attacks the platelet factor 4, which in turn the platelet factor 4 attack will cause the platelet to become activated. When platelets are activated, inside the platelets are the factor 4 pockets. That factor 4 gets released from the activated platelets like little chemical substances. Those factor 4 molecules will then act on heparin and prevent it from preventing platelets from coagulating. And the result is the platelets would start becoming activated, they would start aggregating with each other, and they'll start causing little tiny clumps. Those clumps are the microthrombi, and these thrombi would get occluded into small vessels. The smaller the thrombus, the tiniest vessel it would go and occlude. And so of course if we have microthrombi, then we have a problem with the very tiny end arteries. And here arteries are veins, and so of course eye has very delicate, very fragile, very small blood vessels, and they become a victim of this coagulation. So it is possible that there is actually endotheliitis, which causes local immune reactions, which causes thrombus formation, or it is also possible that a thrombus is formed somewhere else down the line, and then that thrombus just kept flying in and got stuck into the smaller blood vessels. So this is the discussion. Just a very quick view of this. There are of course various weaknesses and strengths. Please, I would request you to look into them as well. Here are various charts where they have been showing. So if you see, these are the forest plots. All of these box plots that you see are on the right side. None of them is crossing unity except here. And they staying on the right side means there is statistically significant data, and these are all the issues in the vaccinated individuals. Then there was another interesting thing that is scary. Within 12 weeks of the vaccination, that is this B graph over here, the hazard ratio within 12 weeks, if somebody develops this issue of the retinal vascular occlusions, then the risk is 3.54, 3.12, 3.88, not risk, hazard ratio, 2.28, 3.97. Central retinal vein occlusion within 12 weeks, 3.97, almost 4 times as high as compared to the unvaccinated. So that is really scary. The diagram A here, I believe, is 2 years, and the B1 is 12 weeks. So B12 and 2. So if you see people who did not immediately within 12 weeks develop retinal problems, then the hazard ratio drops down to twice as many. But within 12 weeks, the hazard ratio is almost 4 times. And similarly, there are other graphs and Kaplan-Meier charts as well. My request is for you to look at it. This is the retinal vascular occlusion. As you can see, they wrote time course of hazard ratios of retinal vascular occlusion and its subtypes following COVID-19 vaccination was demonstrated. Of note, the risk of branch retinal vascular occlusion was extremely high after vaccination. So branch means that the smaller pieces. So here, the smaller pieces are smaller blood vessels. So this is the discussion. Thank you very much for listening in. Once again, there are links in the description of this video. If you would like to support this work, there are links for that. If this is the kind of work you would like to support. Similarly, if you would like to get access to more medical lectures on drbean.com, there is a link in the description, and you can get access at a very, very low price. Thank you very much.